Hey guys, I'm Kelly. This is my channel Incredible Anyway, where I talk about how to live an incredible life no matter what your circumstances are. It's been about 7.5 months since my brain surgery now. So I wanted to update you on that, update you on how my migraines are, and let you know a little bit of what I'm going to be doing on my channel. I filmed a lot during my brain surgery recovery. Was not able to edit, and it's still challenging for me to edit those videos because of the migraines, but when I do have better times, I have worked on editing them. Starting from the next video that I post, I'm going to be posting videos from my brain surgery recovery. It's kind of exciting to watch because you see me improve gradually, but you see me improve. You know, you get to celebrate these like exciting wins that I get, and also see me, you know, have challenges and it be hard. I really feel like it's worth it because I know that there are other people. I've had so many people DM me about this surgery, and so I really want it out there what my journey is like. Everybody's journey is different, but I want that out there. I'm going to be posting pretty much every other day and posting these videos to allow you to catch up, and I will go through June through December. I know that other people post in real time, but I'm not afforded that ability. I really appreciate having it because it reminds me of how far I've come. I videoed the first time that I attempted to go to my mailbox post-brain surgery by myself. Make sure you're subscribed. Make sure you have notifications on because I'm going to be posting. Okay, let's get into my health update. The brain surgery that I had was a craniotomy where they took off a piece of my skull and then they went into the brain and cut a nerve and then put the titanium plate on. The nature of this surgery means that the recovery is long because the brain has to learn how to do things that it used to do in a different way. It used to have 2 vestibular nerves, now it only has 1. So it's relying on that one to relearn how to do everything. So my brain has to learn how to do things in every single situation. While it may be great at knowing how to do things at home, in places where it hasn't been as much, it isn't as proficient at doing those things. So let's start off with vertigo, because the reason that I had this surgery is because I was having debilitating vertigo that kept me in bed almost every day. 7.5 months out, I can say that at least at home, I am vertigo free almost, I would say like 95% of the time. It's pretty incredible. Inside the home, my balance is pretty good. There are things, if I do them, can kind of throw me a little bit off kilter. Again, that's my brain needing to learn how to do those things. Like if I walk turning my head like this, that can throw me a bit off. That's one of my vestibular physical therapy exercises. In the home, I'm doing really, really well. I'm not using an assistive device, and it's pretty great. I've come really, really far. It is absolutely a dream come true and so much to celebrate. Outside of the home, even if I go outside in my yard, or if I go to my parents' house, for example, or I go in public, things are different. My brain is still learning in those situations. Usually the things that affect me more in those situations are vision, like visual stimulation, hearing, auditory stimulation, and movement. Whether I'm watching something moving in front of me, or I'm moving like in a car, or walking, or turning my head. Those are things that affect me, and again, it's just my brain having to learn how to cope with those in all these situations. I haven't been able to get out in public as much as I would like, and the reason is because of my migraines, which I'll talk about in a minute. I have gotten out some. Regularly, every week I go into the hospital for IV infusions, and every week I go in for physical therapy. Hello.
Go ahead, look at me.
1, 2, 4, 5, 4, 3, 2.
Good. Back to you. Good. How you feeling?
All right.
Is that bothering you at all?
No.
That's great. Good. That's the hard part about replicating this.
So I do get out of the house twice a week for those things. Outside of that, maybe I'll have a doctor's appointment or something, but I haven't really gotten out other than that. There have been a handful of times though that I have gotten out, whether it be to a restaurant or to a store, which is incredibly, if you think about stores and all the shelves and all the items on the shelves, it's incredibly visually like, whoa, it's a lot. The first time I went to a store, I have it on video, I'm gonna share that with you guys, but it was incredibly exciting, it was thrilling, and also challenging. Every step of victory that I have is so thrilling because I have been bedbound by vertigo for so long. When I'm able to start doing things again, it's just really exciting. I mean, being able to go to a store is a privilege and it's a luxury that I have not been able to do. And so to be able to start to do some of those things, I feel like I'm at Disney World. I feel like I'm at like my favorite place.
Okay.
It's really exciting. I absolutely am having challenges in public, but the exciting thing is that for a while, when I would go into my IV infusions, for example, I would use my wheelchair because that was how I was safest. My physical therapist and I discussed it. Sometimes at the end of my IV infusions, I don't feel well. I usually don't feel well. And so I'm a bit compromised. So for a while, I was using my wheelchair. And then we progressed to I was using a walker. And just a couple of weeks ago, I've started just using Benny in harness with a cane. And that has been really, really thrilling. So I've been doing that, but I had already been going in public with Benny and a cane. Benny had not worked in harness for a while. We started working in harness and a cane in physical therapy first. So I had like safety nets around me. Benny had kind of forgotten how to be with me in harness. He not that he forgot, but he wanted to pull me, which is not what I needed. So I had to work with him a lot about remembering that he's not there to pull me. He's not a guide dog. He has come so far. I mean, my physical therapist would say, this is therapy for Benny too. And it was. Benny's my assistance device, so I had to get my assistance device to a place where he was safe. But I needed my walker longer because I wasn't used to standing and being stable. And when you use a service dog for balance, you don't put weight on them. You put weight, like I have the cane, I put weight on the cane, but you don't put weight on the dog. Like I'm lifting up when I use him. I'm pulling up on his handles for balance. That's what gives me balance. I do not push down on him ever. When I was really out of balance, really severely out of balance, I couldn't use him. Like he just wouldn't be enough. That's why I needed the walker for so long. Now I'm using just me and Benny in public. I really have not gotten out in public enough for my brain to learn enough to make a lot of progress, but I have made some progress from the first time I went into a store to the most recent time, which was a few weeks ago that I went into a store. There was change. So my brain's ready to learn, but my migraines are another story. I shared with you guys the video where I started the Vyepti IV infusions for migraine prevention. Basically, I am on this dose. It's 100 milligrams, and I have to be on this for 6 months. I get it every 3 months. After the first 2 doses, then I reconvene with my neurologist and then we talk about should I increase the dose for the 3rd infusion. Unfortunately, that isn't until late April, if not more early May, I don't know exactly, that I will be getting the higher dose, and then it takes a while for it to kick in. This migraine journey may not change for a while. It may, I always have hope, but having been in this migraine brain for 18 and a half years now, I kind of know. There has been some improvement since I've been on Vyepti. I still have daily migraines, but I will sometimes have a part of the day where it's better, or I will even have maybe a short break. It's not for very long, but I have them, and I can tell you it's nice to have that as compared to how it was before the biopsy. I have a lot of hope that when we turn, the knob up on the dose, that will be a lot better for me. Right now I'm at 100 milligrams. The next dose is 300 milligrams, and that's the highest dose. So right now I'm in bed daily, and that has been a huge challenge, and it's been very frustrating for me. It's hard because it's impeding my ability to heal in my brain surgery journey, so that's going slower than if I didn't have these other health issues. It has been a really emotional, challenging journey. I will talk about some of my other health issues that I have. I've been dealing with PTSD. I'm not going to go into that, but it has been very challenging. I had a colonoscopy and an endoscopy. The endoscopy showed that it would be helpful if I had more testing and esophageal manometry. It's where they stick a tube down your throat, in your esophagus, all the way down into your stomach, and then you swallow, and the tube has these pressure sensors on it, and it measures the pressure from when you first swallow all the way down, and so it can tell if you're having a swallowing problem or dysphagia. It turns out that I have a hypertensive lower esophageal sphincter, so the muscle that is between the esophagus, the food tube, so say the food tube goes here, and then there's a stomach right here, there's a muscle, and it's always holding closed, and at some point it has to relax to allow the food go through. Well, mine is hypertensive, so it remains really tight. Not so tight that it can't relax at all, but it's very tight. In February, I'm going to be going in for Botox. I'll have another endoscopy, and in the endoscopy they'll be using tools. So endoscopy, they put a tube down my throat, and they'll insert tools into my esophagus, and they'll insert Botox into that muscle, into that lower esophageal sphincter, and it will help it to relax. It's not a permanent procedure, which I kind of like because it will help me determine if it's something that I want. It's the least invasive thing they have. They don't have any medications to take for it. So hopefully this will be very helpful for me. Unfortunately, this winter, my psoriatic arthritis has been flaring. I've been having what I believe are fibromyalgia flares that I've had in the past. I don't get them very often, but I have been getting them. And so my joint pain has been worse, and my fingers have been swelling. I see my rheumatologist again in February, so hopefully we will talk about what to do about that. So those are the main things. Let's tell you some fun things that I've been doing. So I started learning Korean about 5 weeks ago. A couple of years ago, I kind of started but didn't really start. Like, I learned the alphabet, but that was pretty much all I did. Like, I knew how to sound things out, but I knew a handful of words, but I wasn't intentionally learning it. I have been learning Korean using an app called Duolingo and some workbooks by GoBilly. He has a YouTube channel as well. And I have been working on writing my novel, which I started a couple years ago. Again, like, these are things that I can't always be doing because of how I feel physically, but when I can, I do them, and they bring me a lot of joy. I really hope that my migraines start to get better soon. I barely see anybody. I barely get to spend time with anybody because of how physically I am doing. Now that we're getting the Meniere's under control, I need to get the migraine under control. I'm putting on a good face now, but it has definitely been very challenging. I really have had to dig deep and remember the things that I've learned over the last 18 and a half years of being disabled by chronic illness, which is there are still good, wonderful things in my life. Even though maybe I can't do what I want to do, or maybe things aren't going how I thought they would go, I still have wonderful things in my life. Those things may be a pillow that I got from my friend that has BTS on it, like, that makes me happy. And my dogs enrich my life so much. It's remembering that there are good things, even though there's a lot of challenging things. It's really hard. It's really hard, and I'm having to hold on to hope. And I think that's the hard dichotomy with having chronic health issues, is that at the beginning of 2023, I said that I wanted to live more in the present moment. And I really believe that I did that. It's also challenging when you want something to improve, and you know that it's going to take time for you to improve. My brain surgery, the recovery, these migraines now. I definitely am a very patient person because of it. I'm so used to having to wait. It is necessary, and so this is the way that life is for me right now. And I know this is the way life is for a lot of people. That's why I say you're not alone, because you're not alone because other people understand. I understand. Even if we're not in the exact same situation, we understand. And you're not alone because people care. My heart goes out to people who have chronic health issues, because winter can be rough for both mental and physical health issues, and I know a lot of people that are struggling and suffering, and just want you to know you're not alone. Like, I wish I could hug you guys. I really do. Like, I wish I could hug you. I wish you could know, like, you're not alone. Like, I'm here with you, and we're gonna get through this. We are. One step at a time. Fighting. Truly. I love you guys. Don't forget it.
You are not alone in this world. You are not alone. You are not alone in this world. You are not alone.